Thank you, Mbulubinaka. It seems after quite a while, and then we're having another press conference. But yes, Dr. Elisha and I will be overseeing this press conference. As announced by our Honorable PM this morning, on Saturday, we detected a positive case of the virus in a member of our security forces who was working in the border quarantine facility. The soldier in question tested negative for the virus during a routine testing for border staff on the 10th of April 2021. Despite showing no symptoms, he was tested again on the 17th of April in line with our border quarantine procedures. That was when the positive result was registered. We suspect he contracted the virus from 2 Fijian citizens who returned to Fiji from India on the 10th of April. They both tested positive for the virus and were transported to an isolation ward of Lotoko Hospital on Friday, the 16th of April. So we're dealing with a transmission window period that extends from about 1 to 6 days. The soldier was staying on site at the quarantine facility, as is the protocol for all our military personnel on rotation through border quarantine duties. He is reported to not have left the site at any time during the transmission window. However, given the potential window for transmission may be prolonged, we have to assume that the soldier had some contact with daytime staff of the quarantine facility, including hotel workers. These are staff who have gone and entered into public spaces. So while this is still a border quarantine case, there is a serious risk that cases could have entered the community, that the virus could have entered the community. That is why we are acting with decisive precaution to prevent any widespread transmission from this case. For us, this level of extreme precaution is a benchmark in keeping our people safe. This is a benchmark that we have maintained right from the very beginning. From last night, we had embarked on a contact tracing effort to identify those who came into contact with this individual, as well as members of their households. We have identified 69 first-generation contacts. These are individuals who are working in the quarantine facility during the period of transmission, during the time when there was a window of transmission. And while they may not be in close contact with this case, we have deliberately widened our definition of first-generation contact to cast a wide net out of an abundance of caution. These individuals are all now in quarantine facilities, where they will be quarantined for 14 days. So far, 56 out of the 69 first-generation contacts have tested negative for the virus. 13 results are still being processed. We have identified and contained 267 second-generation contacts. These are individuals sharing a household with a first-generation contact of our index case. These individuals were also taken into quarantine facilities last night and are being tested. We should have some results tomorrow. As these results come in, we'll have a clear idea whether our contact tracing needs to expand. But as of today, we are very comfortable with how wide we have cast our net. Right now, our priority is in obtaining the clearest possible picture about the potential length of the chain of transmission. The Prime Minister has identified or has discouraged people from non-essential travel and gatherings. We expect to update the public on any new health restrictions in line with that announcement tomorrow, depending on the tests that are coming in. This soldier in question has already received 1 dose of COVID-19 vaccine. We know that offers some level of protection for him. However, we cannot say with certainty whether or not this has limited his transmission of the virus to others, even though global data does suggest that viral transmission is reduced even after one dose. What we can say is that this individual did not violate any of our protocol. He was wearing the proper PPE, and he never left the facility to enter the public arena. His interaction with daytime staff of the quarantine facility was in keeping with our protocols. However, given the potentially wide transmission period, we have to spread our contact tracing net wide and early. So essentially, in this case, what we have done is that we've expanded the definition of what we call a first generation contact because of that wide potential transmission period. Fiji's security protocols have done exceptionally well in keeping us safe, and we'll use this opportunity to strengthen them further, particularly to prevent the spread of new and more contagious variants. We have always said that our containment of COVID-19 has depended on the commendable efforts of our frontline border staff, but none of us should become complacent. As multiple border breaches in other countries have shown, as long as this virus is out there in the world, we will remain at risk. Actually, this incident is a test of our next level of containment. This is another level of containment that we tend to underestimate in the public arena. And this level of containment is our ability to respond, to quickly identify cases, isolate, treat them, and quarantine their contacts. With 336 primary and secondary contacts identified and brought into quarantine facilities just overnight, we are off to a good start, thanks to the tireless efforts of our teams on the front line. We have now 73 cases of COVID-19 reported in Fiji. But what we may have forgotten is that the first 18 cases were detected outside the border quarantine area. It was detected in the community, exactly a year ago, in fact. And the response that you have seen today is based on what we did successfully to contain those 18 cases. We have learned a lot of lessons from those 18 cases, together with the new knowledge that we have about the virus. It is based on those lessons that we have learned, that we have been able to work very quickly in containing 336 contacts overnight, starting from 10 o'clock, and we finished our last contact was something around 10 o'clock this morning. This incident reminds us again that the only sustainable way in which we protect Fijians will be through COVID-19 vaccines and in our hands, face, and space COVID-safe behavior. Our border quarantine system has performed exceptionally well, but it is not perfect. Immunity through vaccines is the only long-term solution. As we immunize more of our people, we expect to see health restrictions relax. However, our focus at the present time is in containing the potential spread of the virus from this case. The Fijian public can assist us in this effort by employing the good habits that we have developed over the past year. Wash your hands, maintain physical distance where possible, stay home, report your symptoms if you are feeling unwell. And when you have a chance, be vaccinated. Come forward. Our next batch of vaccines arrive tomorrow. And we continue to work on procuring WHO-approved vaccines to be brought into our shores to be administered into arms. So please register online or come to one of our in-person registration centers to sort out your registration. Finally, we've received some reports of misinformation regarding this latest case. This is nothing new. We know how damaging this type of misinformation can be, and despite that, some people still indulge in it. By now, we should know how important it is that we all rely on updates from official sources, namely the government of the Fijian government and Ministry of Health and Medical Services Facebook pages. Good information from credible sources has always been the key to defeating the virus. Thank you. We should be open for questions. Yep.
Kelly from FBC News. You've mentioned that the generation contacts were identified. There's 69, all in quarantine, and there's 56 that have come back negative. Will these 56 again go through another routine testing?
No.
Yeah, I probably should answer that. So all of these first generation contacts will go into 14 days of quarantine. We've done their first round of testing for that first 56, and the remainder are being tested, and we're just waiting for their results. They will be tested again at about day 4, and then before release at about day 12. So it's in keeping with our standard quarantine procedures.
Dr. Fong, maybe from the Fiji Times, what happened to the contact tracing app that Ministry had implemented earlier?
Yes. That has been used. We had used that contact tracing app to, when I mentioned about the fact that the soldier did not go anywhere, that was used. We used the contact tracing app. But I do need to be very clear to people. The app is really, really useful when you got a community transmission. See? So if one of these people become positive, one of the contacts that we identify be turned out positive, that's when we're going to be looking at that app to help us. Right now, we are working off the index case as a border quarantine case. And we are trying to establish whether or not there is a possibility of community transmission. You got that? Right? Once we have confirmed community transmission, yes, the app will start working.
Dr. Fong, Shanil here from Fiji Village. Do you think it is a need now for hotel workers to stay in the hotel during the quarantine period, just like the health staff, sorry?
I tried to allude to that. What we have done is that what the people that we keep in a bubble are those that are actually in contact with the persons that are there being quarantined. Those who are working in the hotel but are not in contact with them, they are not those part of the bubble. Okay, that's the first thing that I should say. Now, the second thing I should say also is that the definition of a bubble is actually a technical one. It has to be defined according to the risk of the situation, not according to the perception of the public. And this is why it is always nuanced according to the way we work and according to the risk that we see. Yeah. We try to explain to you the meaning of a bubble. That doesn't mean that your perception of what the bubble is what the bubble we operate. How we operate it is a technical problem. It's a technical issue. And I do ask, this is part of the misinformation I'm talking about, where people who in the public arena then try to become experts and tell us that what we're doing and what we're not doing right. Sorry, that's how we interpret the bubble is ours. It's a technical issue. I will then explain to you how the general terms of a bubble is defined. But we need to stay with the focus that we are managing the risk. We're not managing the perception. Thank you.
I'd like to just add to that. What this case has also shown is that the measures we have in place for our border staff are working. So this person was tested as part of our regular testing. The last time he was tested and he tested negative was just last Saturday, April the 10th. And the next time he was tested, his sample was taken on Friday, April the 16th. So that's how we know that that is our period where he would have gotten, the transmission would have happened from one of the positive COVID cases. We can define that because we have that standard testing that goes on for our border staff in the border quarantine facilities.
Can you speak about the level of strictness when it comes to protocols within where these frontline workers meet? You say there was no breaching protocol
Yes.
by the index case, but could you say, can you say that there was a level of complacency if you do find that other frontline workers within that area are infected?
I think every time we have a case like this, we have to investigate. That's the first thing. We do know, and both of us have read so many reports where nobody was complacent. One of the peculiarities of this virus is airborne transmission. And the airborne transmission is the one part that we can never control, no matter how good we try. You can't control for something that's invisible and floats into your throat and nose. So airborne transmission is good, and we do know that there is a chance that he was at risk of airborne transmission. We've already established that. But I think the details around that is we cannot really discuss, because that's something that we would. The guy himself is already in a bit of a shock about it.
Do you know the variant of his case? Is it?
We haven't. We don't routinely test for variants. What we do is that we escalate all our protocols to cover for variants, no matter what. And plus, we are also mindful of the fact, even if we test for variants, we're still going to apply the same principles.
Dr. Fong, you had mentioned that the incident is a test for another level of containment. Is the ministry relooking at the protocols again?
I think what I was saying.
Yeah. Well, I can say we're always looking at our protocols. Every time we notice a breach in other countries, we look at the reports about what happened with that breach,
Yeah.
and we go through our own protocols again. So obviously, with what's happened here, we will go through our protocols again. But as Dr. Fong mentioned, there are certain things that are very hard to mitigate. I've seen in, I think it was Australia recently, where some quarantine passengers were staying in rooms adjacent to each other. They never left the room, but somehow they all got the same variant of the virus. So this is very difficult to explain except for airborne transmission. So we know that if someone is symptomatic with the virus, as these cases from India were, it increases the chances that you can spread that. And so something as simple as opening a hotel door into a corridor could actually facilitate the spread of the virus. So that is quite difficult to mitigate, even with the best measures in place. But we are looking at all of our protocols again.
Like you mentioned that you've contact traced 69 people so far. So based on that, which areas in Fiji are at a risk of possible transmission?
As you know, all our quarantine places are in Nandi. So of course, most of the workers are in Nandi. Most of the people who are operating that area will be in Nandi. But I think there is. I think it's best that the whole of Fiji is alert. We'd rather that whole of Fiji is anticipating that we will have to escalate measures if we find some positive cases among the contacts that we have quarantined. Once we test them, if we find some positive cases there, then we will start escalating all our measures. I think it's important also to notice that what we both talking about here is that we want to nuance the public health restriction measures according to the risk. We don't want to just anyhow do anything. We don't want to just lock down the whole of Suva for nothing, just because we think there's a small risk. We want to understand the size of the risk before we start talking about lockdown. Okay? And I think this is really important to the people of Nandi and Lautoka. Please, some people already wanting to go to lockdown. I said, if you want to go to lockdown, lockdown yourself. That's good precaution. But we will declare such a measure as and when the risk dictates that measure.
Dr. Fong, just a point of clarification, sorry. I understand that the guy who had the virus had already gotten his COVID-19 vaccine jab. Does that mean that anyone who gets this jab is still subjected to getting the virus?
I think we've mentioned that in the past. The vaccine actually protects you from getting sick. See? Severe disease, hospitalization, death. That's what it protects you from. It doesn't protect you from actually getting the virus. There is a reduced chance of getting the virus, but it doesn't mean it goes down to zero. There is some chance that you can get mild symptoms. Okay. So he is just demonstrating that he had the vaccine in the first batch. That's more than 14 days ago. We are glad that, he has been vaccinated because he's protected from severe disease. In fact, he's asymptomatic. He didn't even know he was sick, and that's part of our problem. We can't work out the period when he's been infectious because he was asymptomatic. He didn't even know he was sick. Usually, if we had a symptom, then we count back 48 hours and then we start looking for all the contact. In this case, we don't. So therefore, we have broadened our net in terms of deciding who are the first generation contacts. So as I mentioned, there is a lot of technical details that walk into this place, and people should be very careful on how they want to interpret our actions, and they should be very careful, especially when they start picking on things and spreading misinformation.
I'd just like to add that he had his first dose. This is a 2-dose vaccine. To get maximum protection from the vaccine, you need both doses. And we give the second dose a maximum of 12 weeks apart. So he has not received his second dose yet. We know that if you give the first dose, as Dr. Fong said, there is some level of protection. And none of the vaccines that are there for COVID, or no vaccine for any disease, is 100% protective. We know that also.
So he could have tested positive because he took the vaccine? Is that a possibility?
So what are your existing protocols for the time staff at this quarantine facility, other than the same security personnel?
All the daytime staff, at the moment, the daytime staff, the ones who are sitting outside of the bubble, they do get swabbed as part of our routine surveillance system, but they are not like kept away. I don't know, I really have to emphasize this point that we need to dictate the size of the bubble, because if it's a slippery slope on both sides. If we do not dictate it according to the risk, the bubble can keep on expanding until you include the whole of Fiji, which is equal to a lockdown. See? So we actually have to be careful on how we increase the size of the bubble to make sure that the bubble is appropriate for the risk. In this case, every single hotel, it's the people who are actually manning the rooms, and they are the ones who are part of the bubble, not the ones who are sitting at the reception table writing papers far away from the people who are manning the rooms. Those people there are certain protocols that they are used to protect them. They put on their mask. If you go to Tanoa, you got this big perspex glass on top of the reception table, so that the people, when they walk past the reception, they're quite far away from the reception. But then there is an extra protection from the perspex glass. Everybody wears mask. Everybody wash their hands. All those things are something that we always do for the people outside the bubble. Yeah, but we cannot afford to expand the bubble without logic.
The interaction is minimal. Keep the interaction.
Yeah, we keep the interaction minimal. There's all those things.
We also, as well as the testing, we have an absentee register for all
Yes,
staff,
that's another one.
and that's very important. Our health staff at the borders keep very close track of any staff that's absent from work. They are followed up, and if need be, they're assessed as possibly having symptoms. They are tested. That's something that happens every day at the border quarantine facilities.
So can you just clarify who are the first generation and second generation? Technical term.
I think it's your turn to explain
Yeah,
it.
so it's mentioned in what Dr. Fong, his speech earlier. So the first generation contacts are anybody who was working in that border quarantine facility. That's hotel workers, that's health staff, because we've established that he did not leave the facility. So generally when we talk about a first generation contact, we say a close contact. But this is not just close contact. These are close and casual contacts. So anyone who was working in the facility for that period of exposure, we've said are first generation contacts. The second generation contacts are the household members of that first generation. So they never had contact with the actual case, but they've had contact with the contacts of the case. So we've tested almost all of those first generation contacts, and they've been negative. We're just waiting for a few more samples. But all of the contacts, first generation, second generation, are in border quarantine facilities now, and all will be tested.
Yeah, I think it's important, like I said, we get an index case. We look at the scenario, how the index case became positive. Then we create what we call the first generation context. The general principle is the close context, But many times we also go into the casual context. In this case, because the window of opportunity for infection is wide, we are moving into the casual context as if they are close contacts. That's why we make them first generation. After that, and then we go for the second generation of contacts. Our principle being, every time we find an index case, we move 2 generations forward. So if in the first generation of cases we find one positive case, we will then, the context of that person become primary context, primary or first generation, and we'll start looking for the context of this group. And in fact, as I speak, many of the contexts of the second generation group, the list has already been assembled. Because we know we have to recruit that group as soon as somebody in the first generation of people get positive. So what we're trying to say is that our strategy is always to move 2 generations ahead of the index case. Of course, it comes to a point, if we had too much transmission, then we come to a point where we can't do that anymore. But at this point in time, we can do that.
So my last question, considering the index case, considering the virus with someone from India, and considering the rising cases in India, is there any possibility of changing the protocols around those who come from India?
I think there is. Papua New Guinea was easy. I could stop even our citizens from coming from Papua New Guinea and start looking at our protocols and changing the protocols to tighten up in Papua New Guinea. With India, it's a little bit difficult. Many, I don't know about this case, but I know the type of cases that come in from India, a lot of them are our patients. And you know, once you get discharged from the hospital, you know, they are our citizens, and once you get discharged from the hospital, that's it. So they have to come back. And so we have to be, I think we have to be, whilst we will look at more of our protocol, what we probably have the opportunity to do is to ensure that all of them come through a narrow pipeline. Like maybe they all book through the commissioner, High Commissioner in India. Maybe they should all get put together in one place and we test them again 3 times, which we had done before. Granted, we had done before. But we will have to review all that protocol again and bring it back into place. Of course, we'll have to build up also some more vaccinations in and around our quarantine areas. Maybe we'll have to start vaccinating more broadly within from the quarantine staff to the context of the quarantine staff, to the taxi drivers, to the bus drivers of Nandi, to the restaurant owners of Nandi, and start moving out to anybody who engages in any sort of frontline in Nandi. Those are discussions that we will have.
Of all the contexts that you've identified, how many have received the first dose of vaccine? Would you be in a position to say?
No, we don't have that information.
We don't have that information now.
This last question, would you be able to give us an update on the quantity and make of the vaccine that's coming in tomorrow?
I see it very clearly. AstraZeneca through COVAX. We expect to get 24,000 doses, and then after that we'll get some more. So basically, because the next dose is going to be fairly quickly, we might we looking at deploying the whole 24,000, and then we do the second dose in the next batch.
I mean, the India or is it the
COVAX, most of the ones, see, the AstraZeneca is sourced, in COVAX it's sourced from Covishield from India. It's also sourced from SK Bio in Korea, and I think they are factory in Germany. All those things are, they all AstraZeneca. But as far as possible, what we tend to do is that we try to keep the second dose to be the same as from the same manufacturer. We've been doing that all along.
In terms of the condition of the new case, are we seeing any difference with regards to people who are not vaccinated earlier and they tested positive to this one who had received his first dose?
Well, it's difficult to tell because we know that some people have no symptoms anyway. I think about 50% of all COVID cases are estimated to be asymptomatic, no symptoms. But we know this person did receive the first dose of the vaccine and he has no symptoms. So, and we know that even getting one dose of the vaccine can protect you from getting the severe form of the disease and also death. So we don't know, but we think maybe that at least that first dose was protective for him.
I mean, further to that, he's a young man,
Yes.
and young people do tend not to have symptoms.